The conversation is around the COVID-19 National Conference. What were our hits and misses? When we sit down, it's time to debunk this topic. Joining me today is Dr. Alan Ochanji. He is the Vice Chairperson of KMPDU. He is also a periodontal specialist and implant dentist. He's previously served as Senior Resident Periodontology and Implant Surgery. He is a healthcare advocate and holds a master's degree in periodontology and implant dentistry from the University of Nairobi, where he also acquired his degree in dental surgery. Our second guest is Professor Scott Bellows. He is the Assistant Professor of Management, Incubation and Innovation Center at the United States International University, Africa. He was formerly the Regional Director for Europe and Asia, Kiva.org. Formerly the Managing Director was Vision. He holds a doctorate in Business Administration from Durham University Business School, an MBA in Finance and Accounting from the University of Chicago, and another MBA in Management from Witherhead School of Management. Gentlemen, thank you for making time. Dr. Chanji, let me begin with you.
Yeah.
6 months into the COVID-19 pandemic, what do you make of our medical response as a country?
Thank you. Our wait and see approach initially put us into round footing because at a time when we had other parts of the world reporting cases of COVID, we still opened our borders. We had not put any containment measures, and the things to do with the personal hygiene, physical distancing, use of masks, all those were not used. So by the time we were employing them, we were already into a full-blown pandemic. So that really put us in a very difficult situation.
Professor Scott Bellows, I want to bring you into the conversation from an economic point of view. What would you say were some of the things that we got right from the onset of the pandemic, or we've done right this far?
Good to be here. Great question. Some of the economic measures initially were very positive. Lowering the payroll taxes, for example, that was very swiftly done. Other countries took much longer to take economic action. We also lowered VAT taxes. On the judiciary, also the judiciary favoring stability in labor agreements with organizations. So interesting from an executive perspective and a judicial perspective. Also from a psychological perspective, the president's public statements and the president's speeches have been spot on from a leadership psychology perspective. So I think there's lots of positives to go around, but there's also criticism. There was mixed messaging from the Ministry of Health in the beginning. You know, it made it feel like COVID-19 patients were going to be jailed and and held against their will, and therefore people would run away from testing. So when Ministry of Health would go into a state, people would hide, and that was a severe problem in the beginning. So I think it was mixed, some positives and then some negatives.
Great. Dr. Ochanji, you are in the medical profession and you were the frontline workers and response team when the pandemic struck the country. I want to find out from you, what are some of the loopholes and weaknesses in the system that COVID-19 has exposed?
COVID-19 has exposed our soft underbelly in 4 areas. Right? One is the inadequate preparedness in terms of our human resource. Our numbers are so low, and we were worst hit when healthcare workers, some of them started contracting COVID, and some of them were had to go into isolation. That compromised our already small number. The other thing is infrastructure. Remember, at some point we were struggling for isolation facility. Ideally, every facility must have an isolation wing. Because today is COVID, tomorrow we'll have another one. Yesterday it was Ebola in West Africa. So we must be ready always in terms of facility and equipment. The other thing is perennial underfunding. You've seen inadequate resources being put to healthcare. That compromised our response in a way. The last thing is readiness in terms of commodity and supply. We had to go into a lot of problems with procurement because we don't have a platform of constant supply. And right now, as we're talking, there's already issues to do with corruption going on because that was not planned as we were going this pandemic.
And Professor Scott, this breakdown is not just in the medical field alone. I mean, countrywide, we saw a breakdown in coordination between the national and the county government. Talk to us about that lack of coordination that we've seen during this pandemic.
Right. Now, of course, we did see a lack of coordination, but I think in Kenya, sometimes we get hard on ourselves, right? We often see the negatives and we don't see the positives. I mean, there were teams that were sent out from the national side into the counties to work with the counties, right? So I think there was positive and negative, but we often miss it. I think if we look at the United States as an example, with a severe breakdown between the federal government there, which is what they call the national government, and local governments, state governments, so we're not alone in having that breakdown, and I think there was an attempt. But I think a bigger breakdown that happens is here in Kenya with our health insurance, right? Our health insurance companies, the health insurance companies trying to weasel their way out at every turn, every twist, trying not to pay for COVID-19 care for patients. And then the Insurance Regulatory Authority, should be stronger in enforcing insurance companies to do their duty, instead of, it's a pandemic, tons of excuses for insurance companies. In the United States, as an example, is about 277% of your premium payment, right? The coverage, let's say you pay 1 shilling in coverage, you get 277, you only get 25 times, right? So instead of 277 times your premium, in Kenya, we get 25 times your premium. So health insurance companies making a killing, making lots of money, covering people. So I think that is a major gap that's not talked about enough.
And I want to pick up that point because it's very crucial. Dr. Chanji, from the onset of the pandemic, we saw very hefty bills from quarantine centers, and then also trickling down to COVID-19 patients. If you were hospitalized for COVID-19, you would get bills of up to 1.2 million, 500,000. Why were we seeing this kind of inflated bills? And is it still the same up to now?
That's also unfortunate because personally I contracted COVID and I had to pay my own bill, it's something that is not interesting because one, you have to put your bills, you have to pay for medical and then the psychological involvement and all those. That's why you're saying the pandemic, it hit everyone worldwide, but it's better fought if as a country you are a little bit more prepared. Leave alone COVID, we have crazy bills that hit Kenyans. Cancer alone can literally sweep a whole house. So we need to have preparedness and a conversation as a country that we must put health as a priority and invest in it. Because when you're investing in health, look at it from the economic perspective, that a healthy nation is the one that can go to work and be more productive. So from the point that you can spend up to $1 million in terms of isolation, really points into lack of priority as a country, that we don't prioritize health, that if I fall sick today, then other aspects of my life will always come to store.
And I want to stay with you. 6 months in, we are seeing a reduction in the number of COVID-19 cases. Talk has been rife at the Ministry of Health that we might be flattening our curve. Do you think we are flattening our curve?
We might be flattening or not, I don't know. But the fact is, there's some things that you're not being told. One, are we testing at the optimum level in terms of capacity? Are we reduced testing? Because if you test less, the numbers will be less. If you test more, the numbers will be more. So right now, we don't know if we are testing the right numbers. Two, are we testing the targeted population, those who are more at risk? As we speak right now, we don't know. So to answer you whether we are flattening the curve or not, it will be very difficult without objectively answering those two questions.
Well, bearing in mind the fact that we do not know, Professor Scott, we saw the president acting on information from the Ministry of Health and easing some of the restrictions in the country. What do you make of this move by the president?
Right. I mean, the president had to act. When you travel around Kenya now, you see, I would estimate maybe only 10% of Kenyans are now, we're still adhering to wearing the masks, social distancing. A lot of people have gotten tired of it. And there's a scientific reason for that. Human brain, the human brain cannot handle long-term crises, right? In the history of human evolution, our brain developed to react to an immediate flood or a lion attacking us or a neighboring clan coming at us with spears. Our brain is not designed to keep focused for, months and months at a time on a crisis. I mean, look at climate change. The world ignores it, and it's a long-term crisis that's happening. So, adherence, we would expect it to keep dropping. So I think the president had no choice. If people are disregarding the COVID-19 measures, and we're hurting our economy, if people are going to disregard them anyway, then why not just open up? So I think he had no choice in the matter.
Do you think reopening will give a boost to the economy that it much needs?
I think along the way, I think when schools open and universities open, I think that'll actually help, a bigger boost, because you have, millions and millions of children losing a year off their life, a year later to get married, a year later to save for retirement. I think that's going to have lasting economic hurt for us in Kenya for decades to come.
Dr. Chanji, livelihoods go hand in hand with lives. We might be heading towards a full reopening, but as is, restrictions have been eased. Kenyans are free to go to bars, live their lives. What sort of preparedness do we need to put in place? Because as much as we are reopening, the threat of COVID is still with us.
There are at two levels. One, at individual level, we are not out of the woods yet. So the simple things that people have been doing, they must continue doing. It's really ridiculous that the leaders would expect to give us examples, are already drawing very large crowds. Right? We'd expect that people to still at least observe some social distance, at least to wear masks, at least to continue, sanitizing and cleaning hands. But also at the point of the government, they also need to...
What should the government do?
One, make sure that you have adequate and appropriate management of human resources, because our numbers are inadequate. Two, make sure that at least in every county, you have a large and referral facility that has an isolation wing. Three, make sure that we have a proper plan of commodity and supply. Because as we talk today, we've had problems with how masks are being supplied, apron, headgear. Where I'm working, I'm not comfortable that I'll see all the patients today with appropriate protection. So I have to compromise in a way, or I have to see just enough for my protection. So we also have to look for a way of having enough PPEs. And the last thing, we must be prepared as a nation to appropriately put a budget that will go with all those provisions.
Professor Scott, I want to bring you in at this point. Listening to the COVID-19 pandemic, there was a lot of optimism, there was a lot of hope, but Musalia Mudavadi sort of stirred the pot, and he brought about the fact that our national vices have creeped up on us even amid a pandemic. KEMSA is entangled in a scandal with regards to misappropriation of public funds that are supposed to be aiding in the fight against COVID-19. The AG promised that anybody implicated will be charged. Big talk, or are we likely to see something different this time around?
Another good question. I think the bigger issue is whether we believe that politicians who make claims that they will crack down on corruption, does anyone believe it? We hear those claims every year. If we go back to 1964, 1965, 1966, and we look at headlines in The Nation, for example, we see politicians promising to crack down on corruption. We've been hearing this for 50 plus years. So does anyone believe it? And in poll after poll, survey after survey, the answer is no. Here in Kenya, citizens, we do not believe that politicians mean it when they say they'll crack down on corruption.
So what do we do? Because if a vice is to creep up on us at our most vulnerable point, then that means that we are on the edge of chaos.
Right. You'll notice in the curriculums, ethics education often begins in university. And by then, people's ethics orientation, it's too late. Ethics training ethics classes, ethics speakers, ethics programs. They need to start in primary school, right? And there needs to be community bottom-up events. We saw after President Kibaki was elected, and we saw, a huge shift in 2002. People stopped tolerating corruption for a period. After 6 months, we kind of went back to where we were. So we need a huge bottom-up push. When we're stopped by a traffic police, do we insist, no, give me a ticket, I will appear in court? Or do we give them chai, kidogo, to get out of the traffic offense? So anti-corruption, it starts at home. We shouldn't expect top-down to do it alone. We need to do it also bottom-up.
Great. That's one of the lessons that we can draw from this pandemic, that we really need a total overhaul of the system. Dr. Ochanji, I want to come to you. What are some of the lessons that medically we can draw from this pandemic?
That's one, health is wealth. We were worse hit, and there's a point we were not even going to work. There was no productivity. Our economy is affected. So for a country to prosper, number one, you have to invest heavily in health. And you have to look at it from the perspective that being an investment, there's a return. The return is that if you invest in your health, it's a productive nation. Two, this must be a well laid down plan and not an afterthought. Our reaction in the whole pandemic has been reactionary. Other countries were affected as well, but in a way they had a way and a system that worked. So ours was worse because we also had a system that is weak in terms of structure.
Okay. Professor Scott, where do we go from here?
Well, I think, Kenya did several things right. Number one, we listened to science, right? So I think listening to scientists, medical professionals like Dr. Allen here, and to guide us on where to go next, how to properly put our hospitals, how to properly go about our public health. I'm very proud of how Kenya had a much more scientific response than you see other countries. Obviously compared to Tanzania, which was a complete disaster, and I say a complete joke, right? We were way better. I think our response was way better than the United States. I think we celebrate, our achievements. I think we celebrate, good governance when it does happen, even if we think government should do more. And of course it should, right? Celebrate those differences, and let's base our decision-making on science, not on rumors, not on politics, but based on science.
Dr. Ochanji, based on science, we're seeing a second wave of infections in Europe and Asia. We are heading towards a full reopening. Who knows? What do we do so that we don't have our second wave of infection in the country?
Pretty much, you're not yet out of the woods. If you had the minister official talking yesterday, they were warning the country. The fact that you've gotten an infection doesn't mean you might not get it again. So the simple things that we've been doing as a country must continue doing them. The things we've been doing at a personal level, we must continue doing them. And I have to repeat that I'm really disappointed with the political class, because we're doing rallies at a point when we are not sure yet that we're out of the woods.
Your parting shot, 30 seconds.
Right.
I would say that, let me say this. COVID has taught us lessons. One thing I'm glad about COVID is that it has brought a discussion around health as a national issue. That we can sit down and leave our healthcare broad. For the simple reason that healthcare is now a national debate, we should take this advantage and fix the perennial problems that we've been having in the health sector.
Professor Scott, 30 seconds, your parting shot.
Right. COVID-19 is real. I know there is a narrative now to shift away from COVID-19 and have complacency. Oh, COVID was never in Kenya. It's not in Africa. There's that huge new narrative. It's wrong. Millions of Kenyans have had COVID-19. Sadly, millions more might get it before a vaccine comes. And the Ministry of Health needs to act faster in approving vaccines, plasma, treatments with steroids. We need to act faster in approving methods for treatment as well as preventative measures.
Professor Scott Bellows, Dr. Alan Ochanji, thank you for making time. Well, when we come back, it will be time for Social Watch. Our mics will be off and your voice will be on. Stay with Metropole TV.